Hello everyone, I am Dr. Basavaraj from Aster Whitefield from Internal Medicine Department. I am going to speak on today H3N2, which is a very common present day what we are facing. So coming to what is H3N2? So it is a para-influenza type A virus that is called H3N2. Okay, and it is a seasonal virus. So that is what we call as a para. What is the prevalence of this in India? So what the prevalence till now the diagnosis case were around 400 to 500 what we have diagnosed, and there are only 2 deaths till now have been reported. That is an increasing trend. So what happens, this is a normal seasonal flu, that is like already we are in the COVID era, so we are getting close to that. So it is a seasonal area, that is change in the environment, we are getting the flu. What are the symptoms of H3N2? So the symptoms of H3N2 is very generalized symptoms, but I'll try to go in a proper way so that you get kind of information from head to toe. So when I tell about respiratory tract infection, you will have sore throat, very severe congestion. When you're taking food or the any liquid, you feel the foreign body sensation in the throat, and you'll have the post nasal drip. Okay, you'll have a cough which is like whitish initially and later on turn out to be a yellowish color. Okay, that is means you're going into lower respiratory tract infection. Then you'll have kind of burning sensation in the epigastric region because of acidity and all those things, and you'll have pain abdomen, you'll have diarrhea, that is a typical presentation of flu, and you'll feel tiredness, irritability, not able to sleep, headache, and fever. With the fever, sometimes fever with chills and rigors, some fever will have normal fever. So feel like when you have chills and rigors, the fever will be around 101 or 102 degrees Celsius, what we tell. And the other thing is that sometimes they'll have the typical presentation like chest discomfort, chest pain, palpitation, sweating. These are the other part of when you come to the cardiac system. So other thing like you'll have the CNS, that is like brain related issues. What we call is that you'll have giddiness, okay, sudden blackouts, because you won't be able to hydrate yourself when you have flu, so that is causing hypotension, and you'll have a giddiness. That is the things. The other like non-specific symptoms is like you'll feel malaise, like you will not be able to work, not able to concentrate on studies or the work. You'll be like tired even after taking a lot of fluids, even like water, food, whatever it is. So these are the common symptoms what we are going to face. But the thing now, it is a COVID, so we tend to get confused with the H3N2. So what we have to do, the close differential diagnosis, the close what we think when you have the H3N2 is like, one is the presence, it is seasonal, and some people who have bronchial asthma, they have acute exacerbation of bronchial asthma. People like who are having CAD or organ transplant patients who they have tendency to get affected by H3N2. So these are the things which you have to keep in mind before we take some precautions when you are going to doctors and when you are going outside also. This is the one thing. And other thing, how do you diagnose this H3N2? There are so many tests which we diagnose. This is a seasonal. What happens when patient comes to us, we tell that it is a viral, it is a seasonal, it will come down by the end of the 7 days. If it is not coming down, then we have to think of other things. Okay, like COVID is on the rise again, and now the seasonal is like if people are having food from the outside, then the typhoid is very common, dengue, malaria. These are the very common things when we think when patient comes to with these all the symptoms. That is the thing. So how do you differentiate and how do you test? We test normally CBC, and we if the patient is coming in first 2 days, we don't test anything, because the first 2 days the blood picture shows normal, and thinking that you should not tell that you are normal. So initially first 2 to 3 days we treat only symptomatically, we don't treat with any antibiotics. That is one thing. So we do like CBC, RFT, LFT, ECG, X-ray if it is needed, and patient who have comorbidities, we do all the things. Otherwise first 3 days the patients are coming to us, we don't treat, we don't do any investigation in particular as such, we treat only symptomatically. This is how. So what is the treatment that I am going to give to you? So I am going to treat with a normal symptomatic, that I'll ask you to do a betadine gargle or the salt water gargle. I'll ask you to maintain a good hydration, that is 2 to 3 liters per day. Try to avoid the overcrowding places. Try to use mask. Okay, and if you are affected with this, and try to be in isolation for at least 5 to 7 days, and I'll treat you with antipyretics, that is called paracetamol. These are the normal drugs, and we'll give antihistamine tablets, that is Montac-LC and all, to take, so that you'll feel your nasal congestion will come down, steam inhalations. And if you have acidity issue, we'll treat with antacid like Pantop, Rabiprazole. These things what we give and we'll tell you to monitor your vitals like temperature, BP, and saturation at house. And if there is anything lower than like critical value, like your saturation is falling less than 90 and your heart rate is going 130 above, and you are having fever of 103, 104, those things and all, then we'll ask you to contact us. These are what is. So what are the precautions you have to take? So precaution is that when you get these symptoms, try to isolate yourself. Okay, don't try to mingle with the elderly people or the children in your house. Okay, and the main thing is this flu is very common in the, less than 15 years of children and more than 50 years of the any of the age, like that is male or female. This is a very vulnerable period of the people. So these are the things. So what is the treatment is symptomatic, and now there's like in elderly people we are trying to give a influenza vaccine, that is which is given yearly. So that I advise personally people who are at risk or who are at having comorbidities, I personally ask them to take these vaccines yearly, once in a year. That's one thing. So we at Aster Whitefield, okay, have all the facility to treat this, tackle these all the symptoms. Please do reach us to, and we are working 24 into 7 here, and we are able to handle all the cases which are symptoms you have. Thank you.